Good morning, everybody. On behalf of the team and our Board of Trustees, I'm delighted to welcome you all here to our launch this morning. I'd like to thank you firstly for taking the time out today to join us. Just quickly, today we're going to cover our rebranding, our new website, our strategy and plans for the future, and I'm going to say a little about our grants calls. First of all, I'd like to just cover off a little bit of housekeeping. I'd like to talk about the format. So after our introductions, we'll have two short presentations, followed by an opportunity to ask questions. If you want to ask questions during the presentations, if you could put them in the bottom of the screen in the Q&A. After the presentations, I'll go through them in order and I'll unmute them so you can answer them in person. But before the presentations, I'm very pleased to be able to introduce our new chair, Baroness Finlay.
Thank you very much indeed, Adrian. Well, I'm absolutely delighted to be able to take over chairing what is now the CO Research Trust. It was the Gas Safety Trust, and I've taken over from Chris Bealby. And Chris has spent years, I think decades really, working very, very hard through many groups, including our all-party parliamentary group, to raise awareness of carbon monoxide risk, carbon monoxide poisoning, and do something about it. And he has worked very hard to pull together all those who have an interest in the subject. And sadly, many people have an interest in the subject because they or somebody they love have been victims of carbon monoxide poisoning, either severe fatal poisoning, but as we're now becoming more aware, chronic low-grade poisoning. And so one of the areas that I've been particularly concerned about has been that low-grade poisoning. I chaired an all-party parliamentary inquiry into low-level carbon monoxide poisoning and its probable role in diseases. And we really haven't had much of an idea of the role of low-level carbon monoxide, particularly during pregnancy, how it affects the development of the fetus, how it affects children, child development, and then what happens to people as they get older if they have low-level chronic carbon monoxide poisoning. And of course, carbon monoxide doesn't just come from gas appliances, but now it comes particularly from anything which is carbon burning. And wood stoves and so on have become very fashionable. And it's rather alarming to see the level of lack of awareness. And then, of course, as we head into the summer season, we all worry about tents and barbecues and boats, barges with gas appliances on and so on, and camping gear. So the idea of the trust is to be able to really fund good, groundbreaking scientific research to explore some of those questions which haven't been addressed at all previously, and to make sure that we really are developing a good knowledge base based on very sound research. The trustees are a remarkably strong group of trustees, coming again with many years of experience, and I'm absolutely delighted to have them and their support. And of course, Chris has kindly said that he will remain as a trustee, which is fantastic because he has years of experience, and I certainly will be drawing on his background knowledge. So as well as saying thank you for asking me to chair the board, I'm also saying a huge thank you to Chris for all he's done over so many years to get us to where we are now and take us away from just a death toll that there was with carbon monoxide poisoning to really pushing for a better understanding of the other problems that low-level exposure causes and how we can detect better poisoning. We can detect it before it becomes a fatality. So thank you. I'm going to hand over back to Adrian now for him to carry on with the presentation.
Thank you, Baroness Finlay. Right, now we're going to see a couple of short presentations. As I said, during the course of the presentations, if you have any questions, if you want to pop them in the Q&A box at the bottom of the screen, then afterwards we'll have an opportunity to answer those. Thank you. Pleased to have the opportunity this morning to talk to you about the CO Research Trust and our plans for the future. I plan to tell you a little bit about our background, how we've reached the point that we're at, tell you about our team and our board. Then I'll take you through the strategy for 2021-25, and then finish by talking a little bit about our grants process and the timeline for grants for 21-22. Since 2013, the CO Research Trust has focused on funding research and data collection to help us better understand the causes, effects, and treatment of exposure to carbon monoxide. The emphasis has been on better detection and diagnosis, and ultimately the prevention of injury and loss of life. Important progress has been made, but many questions remain. With this in mind, we've launched a new strategy for 2021 to 25, which sets out how we will help find answers to some of those questions. Our rebranding and name change reaffirms our commitment to research with very clear focus on carbon monoxide exposure, but will also support stronger networks to share knowledge, promote collaboration, and develop the next generation of researchers working on carbon monoxide issues. This strategy highlights the areas in which we're keen to fund research, but we are by no means limited to those topics. We recognise that professionals working in relevant sectors and those who've been personally affected by carbon monoxide exposure will have greater insights than we do, and we welcome hearing their views to inform our work. We recognise we cannot do this on our own, and will seek to develop our existing partnerships with industry, healthcare professionals and academia, as well as forging new meaningful relationships. We're now in a strong position to stimulate those advances and accelerate developments in CO research through funding pilot and exploratory studies. Since 2017, we've brought together the UK's leading scientific, industry and clinical experts at our workshop series, which have sought to encourage conversation and collaboration around key areas relating to carbon monoxide exposure. These have included a workshop on CO biomarkers, a workshop on the medical management of CO exposure, and most recently, the effects of CO exposure on cardiovascular diseases workshop. We'll continue to work to bring about the best possible outcomes for people affected by CO exposure in the UK and internationally. In the UK, we're leading the drive for investment into research to discover better treatments, to improve diagnosis, improve quality of life of those affected, and ultimately prevent CO exposure, building on the experience of the last 15 years and the research, reports and workshops that we've funded to date. I just wanted to draw attention to our Board of Trustees and our team. We've been very, very lucky to be supported since our inception by a great team of trustees with a huge range of experience, ranging from industry, academia, first responders, and we are particularly pleased to welcome our new trustees, Bruce Allen, Professor Shirley Price, John O'Grady and Baroness Finlay to the table. We're particularly happy as well that Baroness Finlay has agreed to become our new chair, and I think this is a good moment to acknowledge and thank our past chair, Chris Bilby, who was at the helm of the Gas Safety Trust for just over 10 years. I think, whilst I don't want to turn this into an Oscar acceptance speech, there are a number of other people that I think I need to acknowledge as we enter this latest chapter of our journey. I need to acknowledge the team, the CO Research Trust, Natalie, Gerarda and Glenn, the guys over at BRC, our accountants who provided financial support, the Energy Network Association, who were our home for 8 years, also the APCOG, who we've worked with hand in glove for the last 10 or 11 years, Isabella Myers, who has been an invaluable supporter of our work, and the grant recipients who've had grants both in the past and currently. So I'm now going to talk a little bit about our strategy for 2021-2015. Firstly, this is our vision, which is a world where people are not exposed to carbon monoxide. Not only people are dying, but many are unaware that they're being poisoned at low levels, which can lead to adverse health outcomes. Additionally, there is evidence that suggests that low-level exposure may exacerbate other medical conditions. We want a world where CO exposure does not occur, but understand that this may not be possible. So where CO poisoning does occur, we want it to be easily detected, diagnosed, and treated. We fight CO exposure through funding research, which in turn supports the awareness, campaigning, and educational activities of others, with a view to saving lives and improving the quality of life of those already affected. We have 4 rather ambitious aims, which I think we'd be the first to acknowledge that we can't do it alone. Goal 1 is 0 accidental deaths from CO exposure in 10 years. Secondly, the development of a reliable biomarker for CO exposure and the right treatments and therapeutics for those people who have been exposed. Goal 3 is helping to provide the evidence and data for better awareness, education, and regulation, which minimises the risk of CO exposure. And our final 4th goal, we recognise that CO exposure or the risk of CO exposure can't always be eliminated. So where that isn't possible, our 4th goal is to help develop better detection methods. During our next 5-year strategy, we have 6 key priorities, which, as I said earlier, are not the only areas we're interested in, but the key areas are as follows. Firstly, a novel biomarker. This is a critical area of research. Given the limitations of carboxyhemoglobin, it's essential that a new biomarker is found to make diagnosis easier, to ensure that those who need treatment receive it, and to make sure that all cases of CO exposure are identified so that a true picture emerges. Second, better treatments and therapeutics. To improve the treatments and therapeutics of CO exposure, we need to better understand the mechanisms of CO poisoning, to review and build upon current methods, and to explore the increased susceptibility and specific risks associated with vulnerable groups and those with underlying health conditions. Third, understanding vulnerable groups and comorbidities. It's generally thought that the elderly, children, pregnant women, people living in fuel poverty, and people with underlying health conditions are most susceptible to CO exposure. In order to be able to develop policies and solutions to mitigate these risks, we need to understand and increase our knowledge of why these groups are more vulnerable and what the level of risk is. Next is quantifying prevalence and data. This is an important focus for the Trust over the next 5 years. And it's to quantify the prevalence of CO exposure in the UK, capturing both fatalities and, where possible, where CO exposure was a secondary cause, as well as low-level exposure. We'll do this by funding primary data collection, assisting with the aggregation of data collected by others, and supporting the analysis of healthcare data sets by others, for example, the UK Biobank. Our 5th priority looks at the built environment and energy efficiency measures. The Trust will continue its interest in the effects that the changes to building regulations, energy efficiency measures have, and the way that people heat and cook, and how it impacts on CO safety. To do so, we will work more closely with our industry colleagues to establish potential collaborative projects. And finally, looking at other fuels and environments. Whilst the UK's gas industry has taken steps to prevent CO exposure, thanks in part to better regulation and improved technologies, in other energy sectors, the picture is less clear. With no requirement to report CO incidents and fewer regulatory requirements, it is uncertain what the level of risk and specific issues are in, for example, the solid fuel sector. Similarly, we'll work towards developing a better understanding of the risks in non-domestic environments, including transportation, leisure environments, hospitality and catering, and other specific workplaces. To deliver our research priorities, we'll pursue an intelligent, impact-focused and outcomes-driven approach to developing and managing our grant portfolio. We'll continue to fund high quality research into CO exposure in the areas, but not limited to, those areas I've just outlined in our priorities. Our approach, there's 4 key points to our approach. We'll prioritise innovation in the work we fund. To achieve our goals, we'll encourage innovation. We'll support pioneering approaches and new techniques to prevent CO exposure. We acknowledge that new methods and fresh thinking are needed, and that some may be high risk, but also potentially high reward. We need to be united as a community committed to preventing CO exposure. We frequently witness the impact of CO exposure on people's lives. This makes us committed to its prevention, diagnosis, and treatment. However, we can only do this as part of a community of people affected by and working against this situation. We'll be active in the united community that includes those personally affected by CO exposure, clinicians, researchers, industry, first responders, political and thought leaders, as well as other charities. When those personally affected become actively involved as experts by experience, we're collectively far more effective. Research must continue to focus on the priorities of those affected by CO exposure, as well as those actively working to prevent its occurrence and treating its effects. In addition to this, we'll look for further ways to engage our community in the design, commissioning, and dissemination of research. Thirdly, collaboration is key. We know from the broader research community that a collaborative approach has enabled progress to be made and brought together experts across the country and internationally. We'll work to facilitate and further this collaborative approach for research into CO exposure. We know that we can't achieve this alone. We'll seek to develop further co-funding partnerships with the research institutions, medical research charities, and funding organisations, both in the UK and internationally, where there are synergies that exist to achieve our ambitions. We'll continue to develop current partnerships with industry and other stakeholders. In line with our collaborative approach to funding, we will encourage and facilitate collaborations and consortia between researchers to drive forward our understanding of CO exposure. Finally, the challenge of CO exposure requires an intelligent approach. We'll maximise our impact by being thoughtful and flexible in our attitude to funding research. We will ensure that we monitor the latest research and emerging trends to make sure that our focus remains on reducing risk and that we pursue those areas in which we'll have the greatest impact. I finally now wanted to just talk about our grants process for 2021-2022. We have 2 funding streams, 2 grants calls. The small grants call, which is for grants up to £10,000, and then our main grants call, which is for bids for funding over above £10,000. I thought I'd just remind you of our priorities. Again, as I've said a number of times during my presentation, these aren't the only things we're interested in, but these are the areas that we've identified as key areas that we want to make progress in. Firstly, a novel biomarker. Secondly, better treatments and therapeutics. Thirdly, understanding vulnerable groups and comorbidities. Fourthly, quantifying prevalence and improving data. Fifth, the built environment and energy efficient measures. And then finally, 6th, other fuels and environments. The timeline for the grants calls are as follows. Today, our small grants call opens and will run to the 2nd of July, with decisions on that call being made at our September board meeting. The main grants call opens on the 5th of July, with applications, the application deadline being the 20th of October. Shortlisted applicants will be asked to come to present to our grants committee at a presentation day on the 22nd of November. And with the main grants call, there will be recommendations made to the board for our December meeting. I'll be really keen to hear from anybody who has any ideas for areas of research that we can fund or would like to perhaps make a bid for funding themselves. Whilst it's not compulsory to come and talk to us before you submit an application, it's strongly advised so that we can help you with the process. Finally, if you have any other questions or would like to find out more about any of the things that I've talked about today, please do get in touch by email. My contact details are here on the screen. Thank you.
Thank you, Adrian. Good morning, everyone, and thank you again for joining us today. My name is Natalie Fleck, and I have the pleasure of looking after the marketing function for the CEO Research Trust. This morning, I'll be running through some of the key changes that have happened at the Trust, and I will also give you a brief overview of some of the marketing activities that we have planned for the rest of this year. As Adrian has mentioned, we'll be having a Q&A session at the end, so please, if you have any questions, pop them in the chat box, and I'll be more than happy to answer them at the end. So firstly, I'd like to share with you our brand new logo and strapline. Back in November, we carried out a brand workshop with all of our trustees, and I think we all found it to be really useful in focusing our attention on what it was that we really want to be known for as a charity. I think it's fair to say that the field of CEO research can sometimes be full of complicated words, medical terms, technical jargon, and we wanted to make it as easy and simple for people to understand what it is that we do, and also, of course, what it is that we don't do. Our strapline represents what it is that we want to deliver as a charity. We want to provide evidence to increase safety and improve health for those people who have been affected by CO poisoning. So the name change from Gas Safety Trust to CO Research Trust is with immediate effect. And we are also really pleased to be able to show you today our new website. So you can find it at coresearchtrust.org, and please take 5 minutes, put the kettle on and have a really good look around. The old gas safety website will soon be put to rest. We also have new email addresses. And this is the formula that you will find for everyone at the CO Research Trust. Please, if you can remember, save them to your contacts, because as with all new email addresses, there is a tendency for them to disappear into junk folders. Just to give you an overview, our new website, we designed really with the purpose to showcase the research projects that have been funded by the Trust to date. So what you'll find in each section is a small précis of each research project. For the projects that are complete, you'll find the full reports that you can download, as well as any journal articles that have been published associated with the projects. It was really, really important to us that all of this information is accessible to everybody. We also have a listing section for all of the events that the Trust is involved with and has been involved with, either through sponsorship or participation or facilitation. And of course, we have a section which includes all of the historical CO incident data as well. We will be sending out an email this afternoon using our new email addresses, so please look out for that. It will be containing the a PDF of the 5-year strategy document that Adrian has talked you through. So it's kind of a test really to check that our new website, our new emails are working and they don't all disappear into junk folders. So please look out for that. Moving on to some of the marketing plans that we have for the rest of this year. One of the new things you'll find on our website is our monthly blog. The purpose of the blog is to talk about some of the key issues in the CO research area, and also to help galvanise some of the key stakeholders, as well as, of course, as raising awareness generally about the issues. We will be inviting some people to do some guest blogging, so please do get in touch if you're keen to take part in that. If you would like to receive a link to our new blog, then please log on to the new website, and where there is a link to sign up to the new newsletter at the bottom of every page. We've also revised the Trust's social media channels, and we'll be using these much more going forward to help engage with the wider research and CO communities. And towards the end of the summer, we'll be sharing some information with you about our plans for a series of events and workshops, which will take place around autumn. Generally, it's fair to say our goal is to become much more proactive and interactive in terms of sharing information and news and events and report findings. So we look forward to engaging much more with all of you. And as Adrian mentioned earlier, we have set out some really important goals to achieve. And in order to do that, it's really important that we work very collaboratively with the research community. So before I hand you back to Adrian, I just wanted to share with you a quick screenshot of our new homepage. So along the top, you'll see the main menu panel contains our research, our activities, how to apply for funding, some consumer information, and a little bit about us. I also wanted to share a quick snapshot of our new social media channels. So please do get involved, follow us online, or sign up to our new newsletter via visiting our new website. I look forward to speaking with lots of you very soon. In the meantime, I will hand back over to Adrian. Thank you very much.
So there we go, lots of exciting new things happening. We've got a couple of questions in the question and answer box. If you have any other questions, do feel free to add them. First question we have is from Stephanie Trotter. So Stephanie, I'm just going to unmute you if you want to ask the question. Where are you? Here you are. There we go. Can we hear you, Stephanie?
Hello?
Hello, Stephanie.
Yes. It's a bit of an echo, I'm afraid.
Okay. Well, we can hear you okay.
Good. Good. Well, I do read out the question, but basically I think research is very important, but it's also very important to find out whether someone has been poisoned by carbon monoxide or not. And indeed, St George's is undertaking some research, and I'm trying to find survivors to send to them. But 99 times out of 100, it is not proved CO for all the reasons that I'm sure all our listeners know only too well, because testing the blood and breath, is extremely difficult. So,
Yeah.
and tends to provide a false negative. So we thought way back in 1995 that the easiest thing to do would be to test the air and the appliances for CO. And we've been suggesting this ever since. The HSE did this in 2000 and recommended that the gas emergency service do that. And I cannot see how you can collect data, do research, especially into low level, without some kind of testing. And after all these things like COVID-19, they are all tested for, aren't they? So why is it that everyone seems in the gas world seems to be so reluctant to do this?
Thanks, Stephanie. Well, I think it's fair to say that we, in principle, I completely agree with you that it's really important that appliances are tested, and that we test the ambient air for CO. I think the role of the CO Research Trust would be to support a campaign or to support, lobbying for that to take place by funding and supporting the production of the evidence that would underpin a campaign and convince policymakers. You and I have spoken about this a number of times over a long period of time now, and I've always been in agreement with you. But I think we need a joined up approach, and perhaps there needs to be the evidence to convince those policymakers. It's something that I'm happy to take away and talk to you again and work out how we move that forward.
Adrian, I absolutely understand that you agree with me, but I think I'm with all the survivors, because you've only got to talk to survivors to find out how difficult life is for them. And they often say that not being believed by their doctors and even members of their own families that they've been poisoned is far worse than the life-changing injuries they are left with. And yet, I feel that those in power and even your party group doesn't seem keen on doing this. Yet, Ofgem has told us that if HSE asked them and said it was a safety issue, which we think it definitely is, then things would change. So I know it's not your decision personally, Adrian, but I do think it's the new trust, whatever you're calling yourselves now, the research trust rather than the gas safety trust. So please, I put in a plea to all the trustees who I hope are on board today to consider this, because Ofgem has the money to do it and would do it, they tell us, if they were directed. But it's not their job to do this, it's the job of the HSE. So would Baroness Finlay, Barry Sherman, all the great and good of the gas world please go and see Teresa Coffey and Mims Davies, the ministers for the HSE, and ask the HSE to order this. That is all that needs to be done.
Yeah. Okay, well, I'll take that away and I'll make sure that we discuss that next time the trustees all meet together. And perhaps that's something that I can discuss with Laura at the APCOG, whether there's some way that we can work together on that. Okay, thank you.
Thank you. And the other thing is, there's no support for victims other than what we do. Research is all very well, but surely research and support go together.
Yeah, totally agree, Stephanie. Thank you. Okay. Next question is from Scott Darrock at Gas Safe Register. There we go, Scott, you should be live.
Good morning, everyone. Well, this is just proof positive that I didn't see or hear the presentations in advance. Otherwise, I would have waited for Natalie to unveil the plans. It was just to reinforce the piece around. I think everyone's comfortable that the trust has always, in all its guises, produced excellent work. For those of us who sit outside the immediate requirements for research, sometimes we find that there's something really interesting that we could have done more with had we known about it. And I think that's true for existing and completed projects, projects that are in flight, or even things that are being looked at. So it was really, the question was, and I've got the reassurance from Natalie's presentation, that we always have a look at how we can best share operationalized versions of the research. Academic research is a wonderful thing, but this is about how do you apply it in practice. For those of us who sit in industry, there will be different versions of what operational looks like. For us, we're often looking for material that supports consumer campaigning. I know, Adrian, you and I have talked about this many times over the years. Natalie, this is your world as well, but it's being able to unpick the headline piece out of research, and that might not be the academically surprising piece, but it might be the thing that will help to connect to the story and make it saleable for a consumer audience. So it was just, in whatever ways we can help, hopefully we've always been a supportive partner in that way, in sharing the information that we have, but I would just ask that you always have that watching eye on what can we do with this? What's its worth beyond its rigor as an academic research piece? How do we operationalize this and make best use out of it?
Yeah, Scott, I agree with you 100%. It's about making it clear and understandable by the message, and that's where we'll make the biggest difference. So really happy to take this offline with you. We can perhaps have a chat and talk about how we can make sure that kind of relationship continues, and that you have everything that you need to help support your consumer campaigns.
It's absolutely open door, and I don't want to speak for Laura because she's on the call as well, but that applies for us as the register, but I am fairly sure it will also apply to the APCOG and the other elements of industry that overlap into different campaigning activities.
Yeah, thank you, Scott. And that leads me nicely on to our next question, which is indeed from Laura at the APCOG. So Laura, I'll just find you on the list here. Here we go. There we go, Laura, you should be able to speak now.
Thanks very much, Adrian. It's been so wonderful to hear from everybody. I think really I'm essentially echoing pretty much what Scott is saying, but from a kind of policy and political angle, and making sure that we can make the arguments so that those policymakers and decision makers, whether that's MPs and peers, or those in the public service or in civil service, can really understand the bigger picture around CO. And often, it is quite tricky getting that bridge between your wonderful scientific work and the kind of the key message. So I hope that by having these open conversations at the beginning, and by having everybody involved, we can all be as clear as possible as to what the eventual outcome, could be used for, and how this research could be used in a practical way to improve policy, and ultimately, to protect consumers as much as possible, and making sure that we do have those preventative actions and preventative systems in place, because that's ultimately what we all really do want. So I just really celebrate this, and thanks very much for giving me the floor.
Yeah, thank you, Laura. I think you've hit the nail on the head, really, both yours and Scott's question. We're trying to operate, as I said in my presentation, more intelligently, that we're not just going to fund research for research's sake, that there needs to be a clear research question which has an output, which has a practical use. We've carried out a piece of research recently where we've reflected on what we've funded to date, and identified the good things about it, but also taken time to identify what the shortcomings are and how we could do things better. And part of that is exactly that we need to be much more aware of what the policy gaps are, and what evidence and information campaigning organisations and lobbying organisations need to be able to achieve their aims, and then to stand behind you all and help to try and fund and support that evidence. So that's kind of where we're going, and that's part of why we wanted to formally announce our strategy going forward. So thank you. I mean, with all of you, hope to be in touch and hope to look at ways that we can work together. So thank you, Laura. I've got one more question here, and it is from Isabella Myers. So Izzy, I'm just going to find you on the list here. Here we go. Okay, you should be able to speak, Izzy.
Excellent. Well, just to really reiterate what others have said in terms of the presentations that we've heard, and it's really such positive news. It's a joy to hear. So thank you very much. I picked up in particular the mention of CO being a global issue, and the CO Research Trust wanting to sort of work in this area. And I was wondering if you could tell us a little bit about sort of any thoughts about supporting collaborative work at an international level. I know that when you were GST, it was really through the International CO Research Network that there was some dabbling, if you like, with international work. But I was just really going to see if this might progress to actually funding research projects.
Yeah, thank you. I mean, I have to declare an interest here. I think we both do that. Both you and I are involved in the International CO Research Network, and that GST, now the CO Research Trust, has been very supportive of the work of that organisation. I think CO, it is a global issue, and the evidence and the work that we're doing should be made available, and we need to have an eye on what is going on elsewhere in the world. So I think that's really key in terms of international collaborations and supporting overseas research. That's something that we've done before. We supported a piece of work with the University of Lausanne. And going forward, we'll be looking perhaps to work with ICORN and other organisations to share information. I noticed that Dennis from the National CO Awareness Alliance in the US has joined us. So Dennis, thank you for setting the alarm. It must be, what, 5 or 6 in the morning there, very early where you are in Michigan. But I think it's really, really important. We don't want to sort of shut our borders and just focus on the UK, because this isn't a UK-based issue. It affects everybody, no matter your background or your gender or where you are on the planet. So no, I completely agree.
That's great to hear, because also we've realised that the UK is, as it were, really leading the way, I think, in our work on CO, from research all the way through to policy, and other countries are interested in what they can do, and tend to be turning towards us to find a solution, or really see what our experience is. So I think in terms of the UK pioneering this avenue, it's a good thing. So the support would be appreciated, I think.
Yeah, thank you. I think it's important as well that you and I know from attending the various conferences that we've been to that there's so much for us to learn as well the other way. If you look at something like hyperbaric treatment, look how it's so common over there in the US. Working with people over in Minneapolis, we've learned so much, and so I think it's something that in our plans going forward, hopefully we'll see more of.
Excellent, thank you.
There we go. So I think that is all of the questions we've had. If anyone else had any other questions, now is the time to ask.
Can I just say, Adrian, I think it's really, really great to see there's been some really lovely, positive, supporting comments in the chat, and some directly and some to everyone. And it's really, really great to see that, and we really, really appreciate it, all the support. And genuinely going forward, we are really, really keen to work closely with everybody. So this
absolutely, yeah, thank you. So, I don't know, Baroness Finlay, if you wanted to say anything else before we wrap up.
Thank you very much indeed. I think the questions have been really interesting, and the way that you have responded. Thank you, Adrian, for being clear. I mean, I think if I can try to summarize it, our role is about finding the answers to the questions that are put up as good research questions. So finding the answers to things that people don't know. The campaign groups do the campaigning. One of the problems has been there hasn't been strong enough evidence to underpin some suggestions for policy. And when that evidence is there, I think it makes it stronger to get policy changes. And the other thing is building on Izzy's very important question about the international. And this is just a personal view, and I haven't taken it to the board or anything, but I think that if we had an application come forward which was collaboratively funded with a funder abroad as well, and well thought through, then obviously that would be something that we would want to look at. I think there are all kinds of difficulties running funding of a project which is being run and managed elsewhere in a different kind of health and political system. So I think we'd have to be really slightly cautious about how we do that. But collaborative grants are the way forward around the world. And I would hope that we'd see applications. And if the group in America are wanting to have a collaborative database of research and a project with Izzy, so that we're involved in the UK bit, they're involved in perhaps the US bit, and there's collaborative funding, then that can only be a strength. Thank you.
Thank you, Baroness Finlay. So let's just make sure there haven't been any other questions before we finish. No. So I think before we wrap up, it just remains for me to thank everyone for joining the call today. Say thanks to our speakers, that's Natalie and I. Thanks for Gerarda and the rest of the team for all the work that they've done to prepare this meeting, to manage the change and the rebranding. Thanks to the trustees for their guidance and input. And finally, I especially need to thank Corgi Services Limited and the licensees Corgi Partners, who kindly gift aid their profits to the CO Research Trust. I'll have to get used to that. And without that, none of this would be possible. So thank you. So I hope everyone has a really good day, and I look forward to hearing from you so that we can work together into the future. Thank you.